As we have been reporting today, an orange alert tonight for air quality. We're taking another live look over the city of Boston right now. Those are not clouds. It would actually be a crystal clear blue sky, not a cloud in the sky today. It's all haze and smoke caused by wildfires burning in Canada. The warning is in effect for every part of the state until midnight.
Joining us now is Dr. Ali Raja, the head of emergency medicine at Mass General. Dr. Raja, great to see you.
You too, Eric.
So what is it in the air right now that's got your attention?
Well, Erica, what we're really worried about are these really small particulate pollutants. They're called PM 2.5, which stands for particulate matter that's smaller than 2.5 microns. And the problem is that they're so small that they can get really deep into human lungs. So for people with asthma or COPD or heart disease, they can really cause a lot of problems as they come in from all this wildfire smoke.
So should those groups, Dr. Raja, stay inside tonight?
Ben, if possible, that's definitely the safest option. As Mike was just mentioning earlier, with an orange level air quality alert, the air is really considered unhealthy for sensitive individuals. That means if you're in one of those groups, you stay indoors, you keep your windows closed, you use a HEPA air purifier if you've got one. If you really need to go outside, if you have to take the dog out, if you have to run a quick errand, you can actually use a well-fitting N95 and that'll reduce the amount of smoke that you breathe in.
Okay, and how about for healthy people? What is the risk for them? Is there a certain time you should be more active outdoors or, try to limit that activity?
Erica, you hit the nail on the head. The risk is more for folks who have underlying health conditions, but for all the rest of us, that risk is still there. It's just a lower level. Healthy adults without underlying conditions, we're less likely to feel immediate effects, but we can still have runny eyes, coughing, headaches, and a sore throat. So if you don't have to go outside today, it's probably a good day to stay inside.
All right. We appreciate the expertise. Dr. Ali Raja, good to see you. Thanks for your time.
You too, Ben.
Thank you, Doctor.